Today, in this section of part 1, day 2, we're going to focus on healing trauma. And we are going to have a special assistant for your work in healing your trauma today. So we're going to start with something that we've done yesterday in a circular breathing, and it is going to include an invitation to this special assistant in your healing today. So if once again, you could get yourself in a comfortable seated position with your spine relatively straight and focus on a ball of light energy at the base of your spine. This is your life force, your life energy at the base of your spine, which you now, with your intention, you will bring on the inhale, that ball of light energy up your back to the top of your head, and then the exhale, let it come down again the front of your body. Continue to inhale up the back and exhale down the front, creating a cocoon of light, safe energy around your body. This is your sanctuary, your place of safety for you to listen to your inner guidance. Now put your attention on the inner sanctum of this sanctuary, your heart area. As you breathe into your heart area, I'm going to ask you to invite your inner child into your heart area, your little girl. Invite her to come and take whatever happens. Don't let your mind decide how old she should be or what she's wearing or anything. Just take whatever comes when you invite her in. Now, it's important that you just be aware of whatever happens. Again, some people do not visualize right off, but you just have a sense of that presence of your inner child there. You don't have to necessarily see it, but you can have an inner sense that she is there with you. Let her know that who she is, what she feels, and what she needs and wants is a vital part of who you are. Let her know that you want her to be with you as a companion in the healing work that we do today. Now, listen with your heart as you ask her what she feels and what she needs and wants most with you right now. And listen with your heart, not your mind. It may come in words or it may come in just a feeling. Again, take whatever comes as what's right for you now. Even if you did not hear anything, just know that your invitation brings her presence to you. Let her know that you would like her to be in your life as a companion every day, and that you will endeavor to hear her and listen to what she's feeling and what she needs and wants. Let her know that even though you may not be able to take care of every need and every want that she has immediately, you can promise that you will never abandon her. Thank her for being with you all these years, and let her know that you will continue to grow in trust and intimacy together from here on. Then With a few deep and clearing breaths, bring yourself back relaxed and comforted in knowing that you have this lifelong companion with you more fully now. Okay, as I suggested, we are going to use your connection with your little one in healing trauma in your body today. But before we do that, we're going to go over exactly how trauma occurs in the body, and breathing is useful in healing it. So it's not just trauma that breath work is useful in healing, but it's also anxiety, depression, and addictive behaviors. Trauma is not an event in a person's life. It is the reaction of our nervous system to whatever event happens, because the same event may happen to two different people, and one will have a traumatic reaction and another will not. Now, we're going to study this in much greater detail with many techniques in part 2 of our therapeutic breathwork training. But for today, we're going to have an experience of doing this work, which we will continue to build on, and you will have the tools to build on from here on. So first of all, I want to briefly tell you the specific benefits of breathing in healing trauma. First of all, the benefits of slower than normal breathing in trauma recovery. Just breath awareness is historically proven method of activating the prefrontal cortex, which has been shown to help people stay in the present moment and out of a traumatic trance state. As we've already experienced yesterday, breathing 5 to 6 breaths per minute, which is referred to as coherent breathing or regulated breathing, for a period of 4 minutes, lowers blood pressure and helps clients reduce their hypervigilant states. And thirdly, mindfulness breathing supports the thalamus, and we'll look at a picture of that in a few minutes. Mindfulness breathing supports the thalamus to function in processing and integrating traumatic experiences into a coherent autobiographical narrative. In other words, we can understand it as a story in our life. And mindfulness breathing, which is slower than normal breathing, reduces the intrusive traumatic stimuli deregulation of our system. It's been known that slower than normal breathing can help, but what is being discovered now and what we are pioneering in is the benefit of faster than normal breathing in healing trauma. When correctly modulated, that is, knowing how to relax on the exhale and stay in the present body awareness, sympathetic nervous activation can help reprogram and reintegrate traumatic responses more quickly than talk therapy or slower than normal breathing. As we will show you how it happens neurologically, faster than normal breathing will gain access to emotional and physical states that talk therapy and slower than normal breathing cannot. When people learn how to use faster than normal breathing and self-regulate, they can potentially avoid re-traumatizing stimulation or release the trance state when they are stimulated and activated. Besides working with trauma, faster than normal breathing can help people recalibrate their body and mind, increasing their self-confidence, their energy levels, and opening to new growth potential.